listening on SIBC Live or SIBC News, the Facebook, the SIBC, or you had a come the radio broadcast SIBC. We would like to welcome you once again. Today morning, you may start with the one for the official program. Now, you may go straight inside the Talkback Show where we got a panelist or to sit down round table here for answer any questions where you got with regards to HIV inside the country. You may here the panel, you may got Dr. Jackson Rake, where him now director below STI HIV viral hepatitis program, and also we have the WHO representative, Dr. Howard Sobel, him also stay here with him in the panel. We have Isaac Mulelo, the National STI HIV viral hepatitis program coordinator. We also have Mr. Ronald, where him one for TB HIV advisor, the Ministry of Health, and Mr. Jackson Martin, him now executive director below SIPA. If you hear him, SIPA program in Migarem Law Country, our the executive director is here with us as well on panel. And me moderator below for today again, Diane Magiro from Health Promotion Department. Happy to us for joining you more of this fella talk back show. But me give him this fella microphone for our first speaker this morning. And before him speak me like him, you where you listen come, you listen good fella. Or you where you got him HIV, listen come good fella. Or if you serve a partner, you tell him listen come too. Or anyone where you Taylor Solomon Islands or even abroad listening online, please make sure you tune him on Radio Blue or Facebook page SIBC. Make him you hear him come status Blue Miller Country with regards to HIV. Thank you, Thomas. Let me pass him on the director, the HIV or the STI HIV viral hepatitis program at the Ministry of Health for giving come keynote or story come about him what not this panel and sit down around him this for morning. Thank you, Dr. Jackson.
Thank you, Diane. Once again, good morning, everyone. We listen to our country, listening to SIBC. By me, like talk about HIV no in general. What na HIV became so see no really meaning good. What na HIV for you say survey about HIV. Theme this year, him overcoming disruption and transforming the AIDS response. This for theme here, what I come up with him after for world him facing several funding cuts, especially low HIV response throughout the world, globe. Okay, HIV human immunodeficiency virus. This time you start looking at HIV come up in the country. Signs and symptoms of HIV, signs and symptoms not really specific by what the early signs blame by can him not really awesome by you know say really talent that somebody him got HIV. So some of the symptoms where say looking at early signs of HIV is by you got fever, sore throat, cough, and ook by got rashes the body blue. What late signs blue na by what man say lose weight. So she's looking man lose weight hard fast too much by initiating him HIV. Or people like said diarrhea kasi more than diarrhea shall last for months. Okay, with regards to prevention, only mode of prevention in the country when available is the use of condoms during sex. So now prevention method where so you encourage where people where or got multiple partners whenever you have sex with them in one, you must use a condom. Transmission him mainly through sex in the country. Other countries what a man were injecting or celebration with drugs or some power and ice or the talent to the air. One for women say spread now, but Lini the Solomon Islands him mainly through sex. And the main mode of transmission in the country. A lot of people but what say that as HIV is you associated with people who got HIV, you touch him out by means of pastly HIV by hands are passed through sharing blow kitchen utensils, even clothes, or you hug them out or you shake hands with them out, HIV inside spread. So stuck up people blame what garants for misconception that you come into contact with them with HIV people. but HIV spread only with him spread them now, so meet them today is through sex, time using condom. Treatment him readily available, him free for everyone. Treatment him for life, and one of a tablet every day. Just like same you kakai normal every day you have to kakai for you live. So HIV similarly him one for tablet every day. Time you never diagnose you got him, but you drink one tablet every day. Him no cure, but him so treatment one him doing is him down in virus here to a level where by all machines blame lo hospital by no side detecting. Him lo there, but him inactive. So time by you custom stage, even if you engage the sex without using condom, by you know passing. I think what people blame me need for understanding this one. That one about treatment. Me like a little bit story too about stigma and discrimination when minister a little bit touch base lo today lo time and dim speech blame. Me like him for people for saving that I mean whenever you say that somebody got an HIV, you should not stigmatize him, you should not discriminate him. Stakala by him looking more than him chicken more. No I mean you should know do him kind of because got him on rights, blood silver. Or same you and I when we tell no got HIV. So you must learn for live with them what people who got HIV, respect him more, just like any other person because HIV is just another disease. Yes, takalimi look lem usem bara death sentence na tan you got HIV but you die na. No, mo hem got treatment as Italian today. Okay, minister hem today hem update milo number of cases blame so far. Me too was in Bamila Talam Kamo, what cases blame me. Cumulative number of cases blame me since 1994, Kasen this time, him 82. So over the years, you may looking 1 to 2 cases every year, but go 2024, you may looking 8 cases. So that one, him sort of him making me was start for alarm, something wrong. Go this year, until November, end of November, you may recording 34 new cases. 25 lokota got males, 9 for lokota got females. Majority lot cases here, hem lo or the people were or the men having sex with men. I mean hem happenly, mina. So you need for learn for respecting what people hem choice the sexual preference for only thing you need for do no more is advice him out for whenever what engage the sex or must use him condom. So another little bit update with me. So this year alone we got 34 new cases, 25 with males, 9 for females. I think I'm no more by me like for now. Thank you, Thomas.
Thank you, Dr. Rake, for that fella. Very short but very informed talk na you give kame where people baravasave what na HIV and the cases and status blame in country so far. Let me give him lo TB HIV advisor, the Ministry of Health, because TB and HIV let go together. You have give him a little bit more insights to that. Thank you.
Yeah, thank you very much, and good morning, listeners and viewers. Yes, indeed, HIV, human immunodeficiency virus, weakens the body's immunity. And as we know, TB is another major public health issue in the Solomon Islands. We record close to 400 cases per year. And majority of the people that actually acquire TB, the Mycobacterium tuberculosis TB, do not feel sick. The TB is latent, is dormant in their body. This sleeping TB in the body usually waits for the immunity to go down and gets activated for a significant number of people. So HIV is one of those conditions that weakens the immunity. That means many people that do have sleeping TB or the latent TB or the dormant TB in their body, when they acquire HIV and their CD4 or the immunity goes down, then the risk of them becoming sick from TB and transmitting the TB is very high for the community. Because of that, TB and HIV are regarded as sisters and brothers in a way, and therefore they should be screened. People who are having HIV should be screened for TB, and I'm happy the program, the National HIV program does symptomatic screening for TB among people living with HIV, and likewise, people that are diagnosed or even suspected to have TB, it's good that they are also screened for HIV. That way, we'd be able to identify both the diseases and have them treated. Importantly, there is also prevention for people who are living with HIV. There are medicines that can be given to them to prevent them from acquiring TB. That's what we call the TB preventive treatment, and this is part of the current national strategy and national treatment guidelines. So that way, people who are living with HIV, if they receive the prevention, then they won't be able to, to get active TB. Lastly, adherence is very important. Either way, adherence to prevention and treatment of both HIV and TB would improve the health outcomes of the individuals affected by these diseases, but also protect the community. Thank you.
Thank you very much. We'll have WHO. But before I continue, listeners, if you here come and lo SIBC, use of a text cam lo 76500 76500 hem number use a text cam la hem, or if you're online SIBC online, use of a give come question below you or comments below you lo comment section below that follow Facebook page. Thank you.
Thank you very much. I just wanted to add on top of our two previous speakers, the national program manager and the national consultant. When TB and HIV run together, there's no question. When you get one, you should be tested for the other. That's a given. The third one in this group is diabetes. And diabetes is extremely common in this country. 1 in 5 adults has it, between 1 in 5 and 1 in 8 adults has it. And diabetes also lowers the immune response. And so with that, they're at risk of getting TB and HIV. So whenever you get one of the three, you should get tested for the other two. That's the major message that I have on that. I just wanted to add one more thing to the national program manager. While having sex is the major mode of transmission of HIV, there are other modes of transmission globally, and that at any moment that could happen in Solomon Islands. Those include if mothers have HIV, mother-to-child transmission is very common, but we can prevent that. We can prevent it through, and talking about HIV, we can prevent that using using antiretroviral drugs. We can prevent that. So if you are a mother and you have HIV, we have treatments for you. The second is through unsafe blood transmission. Blood is being screened in this country, so that should not be a problem, but it's something that we always have to be vigilant about. Injection drug use is a major transmission cause there. And then there's some other much more minor ones globally, but I just wanted to list these because at any moment these could be a problem. And if there is injection drug use in the country, that is going to be one of the major risk factors in the future should HIV get into that group. Thank you.
Thank you very much for that one. WHO representative of Solomon Islands. Yumi Garemlo here, Executive Director of SIPA, and SIPA Hemi Solomon Island Planned Parenthood Association. Thank you, Jack. By you give come insights lo. What na SIPA hem sabe doing and also staka ta herem SIPA, but what really na hem happen inside that fala organization.
Okay, thank you. Thank you, Lord speakers before, and thank you for question. Lo SIPA staka something no mi va doing. Family planning, any kind, yeah. But side lo HIV, I think SIPA am na one of main partner lo Ministry lo Health. Mi fa waka lo Honiara, Auki, mi fa garem clinic lo Auki, clinic lo Gizo, clinic lo Taro, lo Choizo, and clinic lo Lata. So mi fa wakalo staka place. Side lo HIV mi fa lukim HIV o sem nara sexually transmitted infection tu ya. So lo sipa time you come mi fa like for do mo sem one stop shop ya. Time you come mi fa do staka test. Mi fa do staka test for kota different siki o sem gonorrhea, syphilis, chlamydia. Then mi fa by same time test for HIV too. So time anyone come hem staka test. SIPA also waka target population lo mi fal anyone no mo but key focus lo yumi lo solo mi fal focus na lo young people because this fala population lo young people where national policy lo yumi se under 34 ya big group na solo SIPA mi fa welcome anyone no mo for come lot clinic services em confidential one for something staka people like em lo SIPA out service belum confidential. Hemna basis blo service lo SIPA. So by looking at clinics belum full every day no ma. Two type clinic na SIPA garem. One fal na hem stay no ma lo house ya. Narwan mi fa call a mobile clinic where every nurse and volunteer mi fa go lo community. Mi fa garem 7-day one and 10-day one. Whereby mi fa round lot a different community. Mi fa call them hard to reach communities. So place where far away, where clinic no go away. When any road go, you walk about go in lot busya. So take him clinic go look at place osem. Hemna nara service blo mi fala. Lo SIPA once you come then mi fala do mota test. And anyone hem picked up for any serious infection like HIV, by mi fala refer go lo HIV unit na for the patients blo mi go lo there for proper treatment and care. Hem important for go lo there and receive him that false service. But lo SIPA hem na o se men waka mi fadim na mi tatalem kam. Thank you.
Wow, barba good to mas director for you talk sabe kam public. We have SIPA in Honiara, Auki, Lata, Taro and Gizo. Yeah, so province you very privileged for garem na SIPA hem establish lo province blue you, so make every effort. You shall go in, no wait for time you seek no ma. Anytime you like for check him status blue you, if you a little bit save that some risky behavior him happen or no matter no more, but you save go because maybe you are okay, but maybe your partner is at risk of issues where perhaps have taken count for infecting you. So him good for you just check him status blue lot places or same, and not forget time or check him you and him positive for any infection or to refer him you go program responsible or Ministry of Health for proper treatment and follow-ups. So that's how SIPA and work together with him, Ministry of Health. That's very, very good for you, me aware of that one. Again, if you got any questions or any comments, use a text come, we will answer you directly here today no manaya. You may get him the National Program Coordinator, where him also sit down here and just for him aware him you mean no what not of programs so far where you feel are doing with regards to HIV inside the country, maybe not everywhere, but have you started on giving awareness to communities or what not some a program where you carry him out finish for addressing this issue where him baraba one time kick up to maslo country bliyomia.
Thank you. At the end, lo national program mi fala always try for because some role blom mi fala responsibility blom mi fala for STI HIV lo country. So in terms of screening mi fala program the services that him available now na lo at the clinics ya patient where okat come for STI alone. As soon as you present lo clinic with them any STI back at the screen for HIV. The other services where he also screen for HIV or antenatal mothers. Or antenatal mothers where the come lo HIV come for services but also screen for HIV. And also like you hear previous speaker, every patient where I got a come lo hospital or sick with them TB, they also screen for HIV. So I got services here, him as soon as you come with them, those where me mention him here, by him also screen for HIV. Okay, me follow program as you follow aware finish that what the previous speaker Okata also mentioned him about finance. Me follow having problem with him finance, so me follow also work with them other stakeholders like SIPA, mi fala also close with them, mi fala integrate with them okata. So time what garing program lo go out community outreach ot sabe kase mi fala also accompany mokata. Mi fala also work with them okata town council ST HIV program lo town council. Okata also go dream outreach community awareness lo okata evenings lo samfala communities. Mi fala national program mi fala also accompany okata. And mi fala program mi fala our main role too is mi fala try for make sure okata commodities where hemi need for HIV screening must always available in country. So as me here today, HIV screening test kit hemi readily available. Mi fala make sure mi fala must supply out clinics for the test kit available. And also mi fala advise him also any clinic where test him the clients are positive, must always refer in, and we will make sure treatment for HIV him available too. So him responsibility belong follow national program for make sure that the drugs him readily available, or commodities like test kit must available, or condom must available. But there are times where me fella face him too hardship like by me fella run out, but that's him be on law me fella program. So me fala just ask him other companies where Emilio Solomon, me fala sabi that currently we are facing problem with them finance. Me fala need him to support me fala for help him program, make him help for improve prevention lo country. I think that him no more by me sabi talent for now. Thank you.
Thank you very much. Live play this SIBC Facebook page. Hemi open for you. Give some comments and as well text come no 76500 76500. Text him come question play you and the panelists will ask. So will answer. So since you may still waiting anyone for call come or hemi talk save come or give come comment, me just like for asking panel numa. There are transmissions where you may talk about the finish drug injections, mother to child, unsafe blood transfusions, antenatal mothers also screen or things or same. But me like public like before you may hear him come tattoo ya. Taman him tattoo him sa pass him on HIV or some Honiara one, especially tamot share him needle. Me like you for clear him come lo public. Is that a something where you should look out where you should not do him that one or him barawa through him transmit through sharing of needles?
Thank you. Yeah, so tattoo. The issue with them tattoo na if like what a man was said doing tattoo time what using what needles if what no sterilize him good. Time what tattoo someone then what no sterilize him then go tattoo naron but say transform not so HIV from if that person went tattoo him got him. Him say pass law kaine if what no sterilize him or unsterilized needles and him say cause him for him transfer. Since I transfer from, especially sa what immuno sterilizing water equipment for tattoo. Yeah.
Just one addition. While HIV, it requires to have blood on it, so it needs to be quite contaminated. But hepatitis B and C are much higher risk. Tattoo. So any needles that are used for any purpose should be sterilized, basically. Thank you.
So information in like for give out noma is young people or even adults or whoever where you practice him tattoo at him good Thomas, you no share him needles. Him noma a main key message Emilio that one. Yeah? So do not share any needles with any other person because you know sabe whether they have it or they don't.
Okay, Dan, me just like add on that the important message here, like in one needle, one man, yeah? I think it's very important for talent for me using.
Thank you. One for question here. We get him line up of question here now. Maybe you answer or maybe not yet, but the question is how does TB and HIV relate?
Yeah, thank you for that question. TB and HIV relate in many ways. One is HIV decreases the body's defense, the body's immunity, and that increases the risk of somebody developing TB, especially if the person already had TB sleeping in their body, what we call the latent TB. So that is the one relationship. The other relationship is that TB is the leading cause of death among people living with HIV, and that's why we have stressed the fact that it's important to screen people living with HIV for TB and to screen for TB among people living with HIV.
Thank you very much. I think that one embarwa clear good, so embarwa good. Another question, is there any awareness in the provinces? So this one him go law national coordinator no because they say HCC you follow go around and do awareness. What's way inside the other provinces? Is there any awareness going on inside the coordination the Yulo province? Any answer to that?
Thank you, MC. The provinces, every provinces here, they have coordinators, and Mifala always make sure that they have their program law specific provinces block as well. So, the provincial coordinator, also got a plan for doing awareness of HIV during time law is there. Thank you.
Thank you. One for question, Noma. Maybe this person is very a little bit curious because the numbers have gone increasingly very high. Is there any testing rollout for HIV?
That one have me one fella good question. In the past, me fella used for garem test kit run out here, but now me fella garem we have supplies, and we make sure me fella send them go down lokota provinces as well. So yeah, me fella also supply mokota test kit, and if okat garem shot outside call come for me fella supply go provinces.
Thank you. So that one have based lo clinics Noma. Is there a rollout like you go out lo communities for do many testing?
Me fella, thank you. Me fella also train about counselors, yeah, and me fella the important thing lo here, me fella prepare a patient whether result him positive or negative, but next is where I got doing testing, they are also trained for counseling, because you know the effect where a patient time him diagnosed positive, what a feeling, any kind of feeling we have got him by him spoil him, you know. Some fella maybe by think about suicide. So me fella prepare him about nesis those where I got doing testing here, they must be trained counselors, or got must train him too, especially for counseling part there. Thank you.
Thank you. So I have two comments that I want to make. The first is in 2017, all member states of the Western Pacific region, that includes Solomon Islands and 27 other member states, agreed that they're going to embark on eliminating mother-to-child transmission of HIV and syphilis and hepatitis B. And in this country, WHO has supported bringing in test kits that you can test for HIV and syphilis just at one moment in time for all antenatal cases, all pregnant women that come in for treatment. So that is available, and we encourage all antenatal women to get tested for both of those. The other thing I wanted to add on about latent TB is how common it is. We don't have data for Solomon Islands, to my knowledge. Maybe I defer to our program manager, but globally, it's 1 in 4 adults has latent TB, meaning that TB is sleeping in their lungs. So that is something that is waiting to wake up, and that's one of the reasons why the program just embarked on has just started a strategy to treat that latent TB to make it so that it will never wake up. So we kill it while it's asleep.
Sipa, you like for comment?
Yeah, I think me just like support them no more. Isaac lo side lo testing yeah. With them sipa, by you looking me team lo mi fa around lo province ya tu yeah. Time you looking sipa nurse him round with them team yeah. Ota gare mo test kit with them okata. By a lot awareness session about encouraging more people for come for test. So if you looking team lo sipa round, have me good chance for you go test. I think lo Western Province 2-3 big campaign too this year. Misal golo North Vela, or golo Rendova, 2-3 big events inside lo Gizo. So if team hemi round ya hemi chance for you go looking mot lo International Youth Day where tulagi hemi celebrate team belum go round lo tulagi tu then Valamot community 1 week before day ya then end up lo tulagi 2-3 other province auki misal go lo Northern region at go lo Koyo lo Korea Central region so staka time team round you looking at kare mo test kit ya if you feel osem mila go check you move go you ask no more but you ota happy too much for take him on board anyone.
Thank you, Director Blusipa hem toksave kamlo imi that okata help and assist him umi lo that one. So like we say, it's not just a Ministry of Health issue, yeah. Hem yumi everyone. So any partners where you hand in hand with him a program, you save go ahead and with him information and package where ministry him also approve for you me do him too, yeah. So okat sipa baraba big help blow Ministry of Health program na that one side HIV. So thank you for that info. There's another question here. How do mothers protect their babies given they already have HIV?
Thank you for that question. The question is very important because so you may all the mothers time of babule you may say ota sago attending not clinics, antenatal clinics, blood. So time out go attending antenatal clinics. One for a routine something we are doing lot na is your testing for HIV. So the earlier ota go to clinic, the earlier about test. So if you got HIV, the earlier you must start more treatment. Okay, but him take him about 4 to 6 weeks now. If mommy taking treatment for virus, go. But him viral load him go. But him what machines blaming to detect him. And take him about 4 to 6 weeks. If provided mommy must take him good na medicine every day na. So treatment, take him good medicine while important on the HIV. Time you got him, medicine you must take him every day. It's just like food you can him every day. So time him mommy take him good medicine na, time down in virus go a level where him low for good. Then by him reducing na chance for him kasem baby. And by reducing food na chances yeah, because time during delivery na contact with them blood na babies are gotten from mommy. So and now why I'm important for mommy will get HIV, time of babule, must take him good treatment, take him early, and take him compliance to treatment. Never call him adherence. Adherence to treatment must good every day. Take him 1 tablet every day. And
Thank
now how
you.
you must protect him with babies from garam HIV, from what a mommy will garam HIV.
Thank you, doctor. So clear him come time mommy him babule and baby still inside lo belly. HIV no save pass during that whole time.
Hem no sa pass from mommy golo baby time inside lo belly. It's during delivery. Bahin sa pass le.
During delivery or time mommy him born him baby and him contact with him blood na, that's when HIV him save transmit to baby.
Yes.
Just one thing that I want to add on top, a clarification. Yes, it takes time for you to reduce the viral load, which is the way that is the mechanism that protects babies from mothers' transmission. But even a dose, if you were diagnosed at childbirth, even that dose makes a difference. So you should get treated immediately. As soon as you are diagnosed, you should be treated. That's my major message. Of course, the longer you're treated, the less risk there is of transmission. But even that dose immediately before makes a difference. Thank you.
Thank you. I think I just want to add on to that question. No matter if mommy, because some of us we don't go to the clinic for antenatal or checkups and also, and we only come to hospitals when we deliver the baby or we even deliver outside of hospitals. How na ba mi fala save protecting baby during those times? Yeah.
Well, yes. So the major, my major message is first, 90% of women are seeking antenatal care at some point. what we recommend is that they get their first antenatal care visit in the first trimester, the first 3 months, and then get 8 contacts thereafter, or 7 additional contacts. So a total of 8 contacts with their provider. So my answer is we can't help if people don't come, but most are coming, and it's a matter of the health system now doing their job of testing and making sure that women are treated.
Yeah, thank you. I would like to just add something on the mother-to-child transmission. The mother-to-child transmission can occur during pregnancy, during delivery, but also during breastfeeding. And so there are proven interventions that can reduce this risk, like highlighted from the previous speakers, including there are medicines that are given, ARV medicines that are given to the babies as soon as they are born. And this might be given for between 6 to 12 weeks. And this is part of the prevention of the mother-to-child transmission. But the healthcare providers too will guide the mother on the best breastfeeding practices that will reduce the risk. But overall, the most important thing is for the mothers to know their HIV status and start on the HIV medication as soon as possible to decrease the viral load so that we can have the risk of mother-child transmission decreased. Thank you.
Thank you. There's another question. Given the increase in HIV cases recently, what is the Ministry of Health does in tracking the clusters in transmission mitigation of cases?
That one fala challenges belum fala, especially lo kata newly diagnosed patient. We fala try best to for at least getting partners blokota. So we have the information as well, but we fala try best for catching now kat patas blokota through lo kat time kat come for taking, but me fala finding him more challenging where me fala also facing especially contact tracing.
Yeah, I think lo SIPA mi fala support the Ministry of Health. Where some fala new cases this year where come out, mi fa garem 2-3 official lo SIPA where mi fala if ministry hem request mi fa save help lo contact tracing. So, I think this year hem na one fala little bit role mi fa play. But lo certain cluster no ma one fal group inside lo group ya na SIPA save help with them. But not everyone.
Thank you, Sipa, for that. Also, one for question here, I'm saying, is there any cases of school students?
Okay, I think before me answer some question, by me like talam kam lo 34 cases in mi garam lo country. 3 fella him from Ottoman we go donating blood. 4 fella him kind of walk-in clients no come out ask for test. 1 fella him avala bami we him babule him go lo clinic they not detect him garang HIV. 7 fella him from what contacts blood cases we mi fagarem. 8 fella him what people were sick in no good, they not admit lo hospital, they not testing about HIV or positive. 3 fella him from private clinics blame me, private doctors blame me. SIPA him detecting 8 fella new cases this year, so SIPA him doing a lot of work. Good thing about SIPA na is him providing whole environment where him private and yeah, also protecting not clients blame it. So a lot of people would feel free for go taking and using services with SIPA. Lo 34 cases here, 12 follow him lo group where men having sex with men. So na breakdown blood number of cases in Migarem this year 34. So what ask whether any student have garem? So far any student from high school have present come garem.
Thank you. So age range blow you with HIV, what na ba you have go about the highest and the lowest?
age range and predominantly between 20 and 30, young people.
Thank you very much. So listeners, you heard him where him high among you or the young people or people when we just start for exploring life and can also or even go out from that one. But the practices that we do during this fella age have very important that you meet take care of you me. One fella more, how fast is the rate of cases?
How fast? Question. Good one. My looking one last year to 8 fella, this year 34. But projected number and more. This one people test no more. Stuck people out there or need for come test. They probably walk around with an HIV no more country, but don't come test. So you me time you start looking more people admit sikitumas from HIV. This one many more people have been walk around with an HIV for the last couple of years, 2 years ago. They decided if you got multiple partners, or spreading sick finish before end up seeking no good come low, number 9. But it is the numbers how him numbers go, yeah. It's not fast too much, yeah.
Yeah, maybe from SIPA, me just add on go what Dr. Akem say. Lo SIPA, this year, if I look him na lo May, June, and July, hem na increase. First time for me fal experience him kanya tu, mi fal lo May going sa June, mi fal testing 1 case every week, which is also first time mi fal garem. But me look him also cases lo there, then what people go tale mo ta partners lo ta tu for come forward, yeah? And then some time refer go lo ministry for or to go on more counseling and go on drugs or ta partners lo ta come to one for something too lo side lo ta young especially with young men were test positive o kata na ta barava really willing for tale mo ta partners lo ta come for test hem na experience me looking lo SIPA. I think this all fear no more make him staka people no come forward, but also Dr. Akay tell him today once you come early, you take him and then you go on drugs, yeah. No any difference no more, yeah. If viral load him go down, yeah. Him na you mean like him. So that you mean supporting people for live longer, but at the same time him reducing risk blow infection too, yeah, for pass him on. Kind of same. Thank you.
Okay, another question number, what areas of HIV AIDS are funding support going towards?
Okay, me was so thankful lo DFAT in supporting program lo at garang lo fund with the National Health Priority Fund with supporting program of giving supporting program with them I think $1.2 million Solomon dollars. So supporting him mainly go towards doing more awareness, training, and go towards updating and develop updating not guidelines blame HIV and so support and mainly go towards so capacity building load staff and awareness program and develop more guidelines for HIV.
Thank you. Someone him bara consent to mas and him say how na plans ya was with funding ya sabe go lo contact tracing too or
Definitely. Him was Sunday where program look le him. If I need to step him up, not this will contact tracing. With what the women clients blame me, I'm a little bit difficult because before I tell them what encouraging what clients blame HIV, that time what the garam what must disclosing status blood HIV status blood or partners blood. But with women clients blame me, what a kind of fright there. What fright na for tell them go partners blood. If I say na because man by tan round no more physically hamu mo na so hem na why or the difficult but with men hem easier for the disclosure na result status blood golot client I mean not partners blood so what we will need for stepping up now is doing contact tracing so we're looking at garam what names lot people that taking what contacts lot so if me for calling that person if I tell me no more, oh, me for got information that you've been exposed to HIV. Then you would ask, how now you got information? You come to me office, but me tell me. And no matter by best way for step them up, not is for contact tracing. Because and stuck a lot you call at phone or nasa ansam, stuck a power off. So me sa what the numbers that give me for like 212.
Okay, thank you. One follow question normal here. What not difference blow signs and symptoms blow between HIV and STI if someone him got him different STI other than HIV, but what not based on differentiate him not ask. What's the difference between signs and symptoms of STI and HIV?
STI depend I mean STI stuck HIV or STI mainly by garam discharge. Vaginal discharge, penile discharge. With syphilis by garam na sangkam yo kolem soana lo private area. I'm different a little bit from how HIV present. HIV by no looking discharge. Lo private areas.
Thank you. So most of these STIs or some of them and even HIV mostly you sabi only sabi naman if you come for testing. So that's the only way. Yeah. So testing for HIV or sabi lo health status blue through testing is very important.
Yep. So I just wanted to say there are many, many types of STIs, 20 to 30 common STIs. They all have their different symptoms. In the case, for example, syphilis is something that usually is asymptomatic, that meaning there are no symptoms that you see, but a doctor may see a tiny little wound. Other STIs have discharge, other STIs have pain associated with it, but they're all different. They're all different, and they all need to be looked at differently. HIV often, as our program manager said, presents with flu-like symptoms at the very beginning. Then it can go on for 8 to 10 years where you don't even know you have it because it's quiet, and then it can erupt into AIDS where you start getting a lot of different symptoms. Pneumonia is very common with AIDS, especially among children. They have something like 20 times the risk of getting pneumonia as children without HIV. And then something that happens in adults that you just don't see very often in adults is they get thrush. They get candida infection in their mouth. And when you see that in their mouth and on their tongue, little white spots that are sometimes painful, but they hang out there and they're tough to remove. That's something that gives a lot of doctors, a lot of health workers should be thinking maybe this is AIDS. Thank you.
Thank you very much. I think you may hear AIDS and HIV. Yeah, so just explaining good come noma HIV how na him go him AIDS or what na. Tabi mi say HIV him AIDS na ya. Him na maybe some people fright him. So HIV AIDS. Doctor, if you sabi explain him HIV then AIDS.
Okay, HIV not is a virus where you take him. I'm not calling him human immunodeficiency virus. Initially, by the time you take him virus, yeah, I'm still a body go end stage time by usually stage 4, stage 3, and now call him AIDS, yeah. And that's the common side dial. So end stage HIV, him na AIDS.
Okay, so AIDS him him what there that cause him mania for die? Him sicky or him what na AIDS that this person do they die from AIDS or
Okay, AIDS him acquired immunodeficiency syndrome. And now what him stand for him? Okay, time you got him AIDS or HIV, what happened na is what soldier lo body blue virus kill him. Sino got him what soldier for fighting na what sicky time what kasimi. So by no die from HIV, by die na from what other sicky by kasimi. Because sino got him what soldier for protecting body blue. Virus him kill him what soldier lo body.
thank you. So time you got him HIV, him kill him na soldier lo body blow you, yeah? So you mean need him soldier lo body where him protect him me from other kind sickness and flu, TB and all things the same. But time HIV him and time body blow you me him kill him now soldier. Yeah, we have to protect him body blow you me. Time him kill him go him barava go down, any sicky kasim you have die from no because no in immunity or no in soldier lo body for protecting you. Yeah? Thank you. So one more question here. You be time limit because of catch up, but the questions coming in. Do we have a safe home for those who are infected from HIV?
No any such facility mi garam a safe home where ota imi sa putumod man together no ma. Ota stay on house load no ma. So kan facility im no garam.
I think the safest place for auto stop him during time ot siki him lo house na ya. So you me lo house him responsibility blame me for look after him na anyone with him got him HIV with him stop with him you me. In a case or an event of a major HIV outbreak, what plan does the ministry and the partners have to address this? If there is an outbreak in the country, what no plans where imigarim or imigarim plan lo there? Or what now ministry through program hemigarim?
Okay, Jimmy, actually this time now cases blame me go up, yeah, program hem garam or response plan. So what the response plan blame is involved updating more things, what guidelines long fala, doing a lot of awareness, get people to come tested. We will need for training or the more health workers, low treatment, or the call them what prescriber, HIV prescribers, where because by that moment what cases come up the provinces, you need more people available there for treating or the patients blame with them HIV. So yes, we do have a plan and should be implemented next year.
Thank you. So currently treatment hem come from which office?
Treatment hem procured by National Medical Store blame government not procure him buy him. Treatment at the moment, mi falana doing monitoring and ongoing treatment, continuum of care, mi call every patient blame me. While numbers blame him low yet, so him still mi was still some managing. But in the future, we're looking at having more prescribers, HIV prescribers, and involving more clinicians for start doing treatment for clients. We're about garam clinics for what come review. Every time that Otakamlo follow program. That's when we have time what cases blame me go up where by me fellows are able for managing. So if I need him clinicians for involved lo treatment lo clients blame with HIV.
Thank you. So currently Ministry of Health HIV program na him issue treatment currently.
Yes, my good friend Timothy Sanauna him main man behind treatment lo clients blame me.
Thank you. So provinces, if anyone have got HIV, how do they get their treatment?
Okay, you got cases lo province. So what happened is what program him doing is him set them up now what we call them what HIV co-care teams. HIV co-care teams him lo provinces we set them up for managing now patients blood lo province. So whenever treatment me will not send them go. Freighting go plan then go lot provinces by me. So what HIV co-care team na look after management board, and usually this fella pharmacy officer na me was ringing me tell them oh if I send you come medicine to client, so clients are go to pharmacy na for collecting HIV medicines blood.
Thank you. That one him clear for you, Milo, of the provinces. So as we speak, mifala lo country no may a program responsible. HIV him inside lo certain provinces or him all over every provinces in the country currently.
I think him no really good for me tell him which provinces na and sunny same. But yeah, a lot of provinces blame me got him HIV na. And most of them are based lo Honiara.
Thank you. So, no need for you to survey which province. You just need to know your status. The key message we for Barava like for put them out low this for the World AIDS Day or HIV is know your status. No look lo narawan what now status blame. Look lo you seleva and go for testing if you know survey it lo status play you. We have few minutes left lo here, 3 minutes. Me just like ask him each one for just giving one key message that you would like to give to the public today before you meet closing program. So I'll just go around the panel. Just give one message that you would like the country to be aware of with regards to this World AIDS Day.
I think by me comment first time. Like me hear him HIV him on the rise. One of me like for encouraging people blame me outside now is come forward for test because HIV him not dead warranty him. As long as you know your status, by him, you not only helping yourself, but you help him other community people blame me too. Thank you.
Early in my career in 2001 to 2003, I worked in the HIV department in Geneva, World Health Organization's headquarters. And at that time, the treatment regimens were incredibly complex. Today, it's one pill. It's so much easier than it was, so there is no reason for people that have HIV not to be fully treated, not to take the medicines as prescribed.
I think a key message when me like me lo people bring lo country must address him. I mean must do you know is please if not stigmatize him and discriminate him people with HIV. It's just another disease. Of people are got the same rights as him, you and me. So if you say somebody got HIV and should not be something whereby you know say able to sit down story with him all the time and send him. Sikia like us meet talent today and say pass through touching, even sharing of clothes and kitchen utensils. So you really need to stop him not for discrimination and stigma. Lot of patients blame HIV.
Yeah, thank you. HIV is not transmitted through the common social ways we live. So HIV is not transmitted through handshakes, sleeping under the same house, hugging, and etc. So I say this because we really need to support the people who are living with HIV so that they can take their treatment. Treatment is part of prevention.
Thank you. I think from SIPA, two things no me like talem. One is you may just look him na starting blow increase blow HIV. Bye continue for increase. Ota numbers where doctor talem come today, if I hear him na ota partner blood people staka no come yet for doing screening So bye numbers hemi increase. Number two is me like encourage him, especially with young people blame me. Please condom him free. Condom lo every place sipa condom staka. This year first year me for look him that people no use him condom. First time. Me waka 20 years lo space first time me look him. That people no use him condom. So please you for come out condom staka stay no ma. This year me make noise too so ministry order big supply. Condom because lo March, April, May no any condom. But this time condom supply stay. You look him outside road or the young people blame me staka involved drink kwaso at the market house here at evening every community around. This time no only Honiara. Golo province. Next thing after something people have unprotected sex. Please, if you buy them, use him condom. Because if you not take him HIV, buy take him Honiara siki too. Yeah. So me encourage him young people blame me. Come, lo sipa him free. Ask him anyone. Thank you.
Thank you very much. And today too, me like for conclude by thanking him now, or the panelists, baby, we sit down here, and especially you, where you listen, come the live podcast and live streaming or the SIBC online. Thank you, Thomas, for stay tuned. And we hope these are messages when we follow game out this for Talkback Show. He might answer some for question below you, or if you got him more questions, then we follow continue with him radio health program 6:45 Monday to Fridays. You shall listen, come give him questions below you. Will continue to answer them through that medium. Yeah, so listen, come radio health program. I would like to thank Dr. Jackson Rake, the director for the program, Dr. Sobel, WHO, Dr. Ronald, the HIV advisor for Ministry of Health, Mr. Jack Martin, SIPA executive director, and also the program coordinator, national coordinator Isaac Muleloa, for this opportunity where we sit down for talk sawelo public me what now really behind HIV status me lo country. And for myself, your moderator for this morning, would like to thank SIBC for bringing us live broadcast and live online for for public me lo country. And public, this is not the end. This is just the beginning of working together waiting me follow programs the HIV unit, Law Ministry of Health, and our other partners. Together, you miss away out team HIV Law Country Blayomi. From me, put me back Law Studios with him SIBC. Good fala day through you and happy 1st December.